Good evening, everyone. We welcome you today on a special day, April 2nd, World Autism Awareness Day. We have today here two eminent speakers with us. We're going to talk about more, and Hema ma'am will going to introduce them. I just want to yes, said by Temple Grandin. She was a person with autism. Now I request Hemlatha ma'am to take over and introduce our speakers. Thank you.
Good evening, all. Thank you, Garima. I'm very happy, proud, and privileged to introduce my friend, classmate, Radhika, the first speaker. Radhika Poovayya completed her master's from ISHA in 1987 and did her master's in behavior analysis from Florida Institute of Technology in 2010. She is the only speech language pathologist in Asia who is also a US board certified behavioral analyst. Radhika has worked in different settings, from starting the first speech and hearing center in a plantation district hospital in Kerala to a SLP and PRO at Chandrasekhar Institute of Speech and Hearing. She has also worked as a consultant at Manipal and Hosmat Hospital, Bangalore. In 2002, she started Samvad Center for Speech and Language Therapy, and in 2005, she founded Samvad Institute of Speech and Hearing in Bangalore. Presently, she has 3 clinics in Bangalore and 1 in Cambodia, providing a unique integrated approach of speech therapy and applied behavior analysis. She has been awarded the Community Service Award by Rotary in 2016 and the Times Now Emerging Icons in Healthcare Award in 2019. A hearty welcome, Radhika. We are very happy and waiting to listen to you.
Thank you very much, Hema, and thank you, Garima. Thank you, ISHA, for giving me the privilege to share what I've learned, an exciting journey that I had in the last 10 years of learning ABA, applied behavior analysis, and how it has, improved the quality of my services and given me a lot of satisfaction. And so I'm very happy to share what I have learned, but this is just going to be an introductory talk, which I hope my aim is just to help you clear any misconceptions that you all have about ABA, because it's a new science and there are a lot of people will have misconceptions, will not understand it properly. So I hope this talk will help clear those misconceptions and understand how powerful this science is and how effective it is in improving the quality of life of our children with autism. Because autism is one of the most challenging disorders that we all deal with, right? They have not only a communication problem, but they also have such severe behavior issues. So it is pervasive. And that's why when I started my private practice in 2002, I was really stuck. I couldn't show progress. And I was wondering, is there anything else that we could do? Because autism is a spectrum, you get severe kids, you get moderate kids, you get mild kids. So, the severe, medial, and the severe ones, you really cannot help them. We are so stuck. We are not aware. We are not trained as speech pathologists on how to handle those behavior issues, right? And so I was looking out for new, is there anything better? And is there anything more profound, more powerful than speech pathology? And I was very fortunate to be introduced to ABA. So I can start my presentation. How can I share?
Your screen is already shared. You just have to start.
Can you see this presentation?
Yes.
Yes.
Yeah. So shall I put it on presentation mode?
Yes, ma'am.
Okay. All right. So as I was saying, our children are very challenging, and it's a spectrum, and therefore you need, I think, multiple tools to be able to handle all the challenges that they. Some children will have only a language deficit. They will have no behavior issues at all. They're totally compliant. They'll sit with you and they'll learn, but they may not be able to generalize. It will all be rote learning, right? So there are different challenges for our kids. So I find that this understanding of both sciences has really helped me give a very comprehensive treatment for kids that come to us. So we all know the definition of children with autism, but what was, as a therapist, when you sit in front of them, what are the things that confuse you? What are the challenges that we face? One is attention span, the other is compliance issues, the other is obsessions, and the how can I minimize this? The other is they're not at all interested to communicate.
Ma'am, you want to minimize the panel?
Yeah.
Ma'am, there is an orange box with a white arrow.
Where is that?
In the panel, can you see? Towards
On the right
left
side?
of the panel. Left of the panel. Orange box with a white arrow.
Can't see that.
Above the mic, Radhika. There's a video mic and orange small box.
Okay, let's see how long I can do. And they're very uncommunicative, and then they have listening, very selective listening, and they have very inconsistent responding, right? So these are the challenges that we face as a therapist. And added to that, the other issues: temper tantrums, hand flapping, stereotype play, they have self-injurious issues, they have eating issues, they have toilet training problems, they cannot indicate. So there are so many challenges. All right. So, and what were the language challenges that we see in our kids? They can sing rhymes, but they cannot ask for milk or food. They can name all the objects in a book, but they cannot follow any instructions. They can respond only to certain words, but they do not respond to their name, right? So this selective listening is very challenging. Then in play, they will show absolutely no interest in toys. You bring up a beautiful toy, they might not look at it. They might only want some, utensils or sticks. Or they might play with long objects. And then when you take it away, there's a big temper tantrum, right? So ABA gives you a very comprehensive understanding of how to solve all their problems. And so what is ABA? ABA is applied behavior analysis. It is the gold standard today for treatment. It has been endorsed by the Public Health Department in the US and all the pediatric associations in the West as well as in India. Even I was happy to see that AIMS also has endorsed ABA. And of course, WHO also has endorsed the importance of using ABA to reduce and improve the quality of life of children with autism. So a brief history, a brief understanding of what is this applied behavior analysis. It is the practical applications of the behavior principles to solve the behavior problems. And it has a solid research foundation of 60 years. Yeah, so B.F. Skinner, we all have heard about B.F. Skinner. We have all read about operant conditioning. So though he had done those experiments, no, it took almost 1990 before his principles were adapted to training children with autism, and it became popular. All right. So there was a mother who was Catherine Morris, who had 2 children with autism who benefited from the ABA program, and she wrote a book. And after that book, ABA became more popular in the West. So ABA is the science of what human beings do. Why do we do what we do? And it focuses, our job is to focus on only socially appropriate behavior. And in therapy, we work on social skills, communication, fine motor skills, and self-help skills. Okay, we reduce inappropriate behavior and increase appropriate behavior. So the bottom line is how to motivate somebody to learn. And we use only positive reinforcement. We are totally do not use threats or fears or any form of punishment. It is used systematic methods of using positive reinforcement are done to increase the the behavior of the child. So here is behavior B.F. Skinner, the father of behavior analysis. though he uncovered the principles in the experiments that we all have studied. It was their applications have been on in different parts, in different aspects of human life. And we are all specialized in helping children with developmental disabilities. All right. So Skinner's one aspect of it is only improving appropriate behavior, but Skinner has also given a detailed analysis of language. All right. So his analysis is, we all study about it, and it is very, very effective for children with autism because they have selective learning. They have selective aspects of language that they learn very well. The other aspects they're not able to learn. All right. And this is the manual that we use, protocol that we use to evaluate the language. So his student Mark Zuckerberg, and Sundar, what's his name? Mark Sundberg has developed this VB map, and he has a skill assessment protocol as well as a barrier assessment protocol and a transition assessment protocol. So once you assess the skills of a child, we all in language, all the operands, as well as all the prerequisites for language, then you do a barrier assessment to evaluate how severe are his barriers and what is the program we have to do to reduce those barriers. And as therapy goes on, before we transition him to a group setting, we have to see whether these transition scores are good. And then we can evaluate and say, yes, your child is ready for transition. So everything has become very objective, and it's become very objective, and that's why it's become very popular, because it's very result oriented. So the core of understanding all this is the simple understanding that we have to understand what do we define behavior as, because when we are wanting to change, we must know what we are changing. So it is for a newcomer, especially when I started off, I had already worked as a speech pathologist for 18 years, 20 years. So it was really a different approach to look at a particular child, because the definition of behavior had to be taught. You know, we had to learn how do you define a particular behavior, and only then we can think of changing it. All right. So when we define behavior, we define it as anything a person does. All right. So it can be not only good behavior. Before, as laymen, we always thought only good behavior or bad behavior. If somebody shouts or screams, that is bad behavior was used for that, and good behavior, well-behaved child. But all skills that we human beings do are also behavior. The way we talk, the way we eat, the way we sit, the way we stand, the way we hold a pencil, every single thing we do is a behavior. All right. So that means you can teach anybody anything if you know how to define it. All right. So what do behavior analysts specialize in? In only responses that are observable and measurable. So unless I can measure number of, say, if you're measuring chewing, we measure number of bites that he can take with, you know, in that 10 minutes or 5 minutes. We give a time frame and we measure number of bites. If it is words, we say a number of words he can use in this context. So we must have a response that can be measured. We just don't be casual. Yeah, he speaks a lot in the house. We want to know, then only that behavior that we can take. So therefore, the definitions is, instead of labeling a child who's difficult, if a child is lazy, we break it down to say, what does he not do? And that behavior is what we want to change. So if you say he's lazy, we say, well, how do we define laziness? So laziness is defined that he doesn't complete his work on time. Okay, if you give him a job within the prescribed time, he cannot complete, or he may not put things back in its place. So once we define it, we are able to make a plan to change it. But if we use statements like he's very lazy, he's very difficult, where do you begin? Okay, so behavior analysis gives you a very concrete way to bring down, systematically define exactly what you want to change, which is observable, measurable, and then make a plan. All right. So, and the simple analysis of behavior, it is simple. All right. And nobody would believe him when Skinner said all behavior can be analyzed with just an ABC. All right, nobody believed him. They said behavior cannot be that simple. So it is possible to define any behavior in these three components. Of course, there are a sequence of behaviors that is called a chain of behaviors. That this C will lead to the next A, then the next A will lead to the next B and the next C. There can be a chain, but basically behavior has three components. All of us are aware of these things, I'm sure. And our job, we are trained in understanding what is behavior, what is the A, and what is the C. All right. So the behavior principles that Skinner has brought up are all about the basic behavior principles that control that is behavior. All right. So the A controls and the C controls behavior. When you are a layman, before you understand behavior analysis, we give a lot of importance to the A. Okay, because he's angry, he did this. Because he was hungry, he did this. We are not trained to look at the consequence. And Skinner said that the consequence is responsible for maintaining a behavior. So if the consequence is positive, the behavior will continue. If the consequence is negative, then the behavior will decrease. All right. So that understanding was very profound because it helped change lives dramatically. So what is the ABA process? So we identify the behavior, we analyze, measure, plan, and then intervene. All right. So the analysis takes a lot of time. Then we measure the baseline, number of times he's doing it, what form is he doing it, and then we make a plan of a systematic plan. So as a behavior analyst, the training is parallelly, it happens. You learn the theory, but the practical is the crucial thing, right? It's very easy to understand the theory, but how to implement it with each child is where the training is all about. And that's why behavior analysts are trained that the number of hours that you do is very high. The number of hours that you're mentored, individual mentoring is very crucial because you cannot learn this just by observation. Your behavior needs change and you need feedback for that. All right. So when you get a good supervisor to give you right feedback, your skill improves. And that's how you become a better therapist and you're able to implement the procedures systematically. All right. And then we monitor the progress closely and we program for generalization. So there are lots of myths that behavior analysts are not training for generalization. It doesn't generalize. There are lots of myths. So again, as for everything, you need, the science is foolproof, right? It is evidence-based. There's enough research. Okay. But it's all in the hands of the therapist as well as the hands of the parents of how they implement it. A lot of parents I've met who do not understand it. They do not like the process, they will say. And then they'll say ABA doesn't work, right? So that is what I have seen. So what we say is, tell all parents is the behavior is lawful. There is a law for everything. It's just as simple as the science of physics. There is a law of gravity. And therefore the law is that if a behavior is followed by positive reinforcement, it will increase. Okay, so there is no two things. All the principles of behavior are proved in the laboratory a million times. And these are the principles that we adapt in our therapy. And all behavior can be changed at whatever age. So they have broken that myth that early identification is crucial for autism. And I have trained older kids and they've brought them up to a functional level. All right. So because in India, especially when there's not so much awareness, children are coming in late and they're always coming with the thought that, madam, I think I'm too late. He's 8 years old. Is it too late? I said, no, let me see. And once we start working, we are able to bring this child to his potential. All right. And a lot of mothers says, no, ma'am, my child is very difficult. He is, when I say all of us are human beings, all of us operate on the same 7 principles. It's my job to find how to use those principles on your child. All right. And the other important thing is parents are taught and therapists are taught not to blame the child for his behavior. Oh, he is being lazy. He is being naughty. He is being like that. We have to change the environment. He has a disability. He has an issue. Or any child, if his behavior is wrong, it's not his fault. The environment was responsible for that behavior. And who is in that environment? The parents, right? And us. So it's up to us to modify the environment and change his behavior. So that was a big learning, that we can change behavior because it's all in the environment. Nobody is born lazy. Nobody is born difficult. These behaviors are acquired in the interaction with the environment. All right. So with that, I would like to conclude. It's very difficult to get videos because parents do not approve. And sometimes we have very good clients, but we are not able to take videos. So I've been lucky, a few parents here and there. So I have a few videos that can show how effective it has been. But I wish I could get more videos. I hope with time parents will allow us to, use their children's videos to create more awareness.
Shall I play, ma'am?
Yeah, please. Keep going. First, just let me see what he does. So this is Joel. He has multiple disability. He had mild MR, mild developmental delay, as well as autism. And these were his two favorite pastimes. Buckets or these things, and he would otherwise bang them on the table. And if you take it away, he would scream. This was his pastime. He had no form of communication. He would just scream. He did not understand language at all. And therefore, it was very difficult for the mother to see her child do this for 5-6 hours a day. So we started a systematic ABA program. And after the rapport building pairing is done, we analyze what are his reinforcers, and we respect those reinforcers, right? So we do not hide all the toys. We do not hide away these toys, because we understand that children with autism have limited interests. And what do you talk about? You don't talk about an apple and a ball. You talk about what you like, right? So you have to take the reinforcers that he likes and teach him to communicate about them. So this child, we had to teach him. So ABA also, the first mode of communication that we therapists are trained to do is either you have to use some form of requesting. We have to teach requesting as the first response of the child. So what is the first response? All right, is that he should learn to ask for what he wants. And we have two options. One is speech. And if there is no speech imitation, we do not waste time in doing anything else. We teach an alternative form. And research has proved that signs are much more effective than a picture exchange system. It works better and it's easier for the child to learn. So we teach him signs. Can you show the next video, please? So he learned a sign to ask for his favorite objects, and he has limited motor control. So you see how he asks, he uses his hand fist to make a sign for the bottle, and he learned to give up the bottle.
Bottle. Sound. Open.
So he asked for open. He loves the sound.
Sound. What is making sound? Finding bottle. Here, close. Joel, close. We need to close.
So the scream has given way to a
Close.
little protest. Just a little protest. But he gave it up. So he learns to sign for give the bottle, and he's learned to say open it. And he's learned to follow commands too.
Ma'am?
took us about 3 months.
Good boy. Kids,
The video is stuck on my side.
It's stuck
Yes,
on
ma'am,
my
it is
side.
stuck.
Stuck,
It's
is
stuck
it?
on my side due to internet connectivity. I'll play.
sound. Give bottle. Good boy. Here. On.
So you saw how he said the
On.
sign for on?
Says
So once his mands are, once he learns the signs, then we will slowly add eye contact. And eye contact is taught as a concept. After he learns to ask for something, we work on his eye contact. To say that you sign, you look, and then I'll give you what you want. So all the skills are broken down. Yes.
Knock, knock. What's inside? Ball. 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 Good job. Ball. Ball. Say ball.
So you can see that the sign became all right. He's learned the sign very well, and then we work on the eye contact and the speech. And this child has already got the first syllable. He's getting the first syllable step by step. And this child also was obsessed with only pens. He would play with pens the whole day, and he had absolutely no comprehension and no communication modes also. And in this video, you will see how social reward. This child started a lot of training. After 6 to 8 months, he started looking forward to a social reward, social praise of good boy, clap. He would really smile with the happiness, you know. Earlier, it didn't matter at all to him. You can show the next video. When I give you a one-step command, you just watch.
touch head. Give it to mama. Very good. Good job, guys.
So you see the joy, social reward, and completion. Task completion has become a positive reinforcement, and that is the basis for learning, right? We want to fade away concrete and tangible rewards of chocolate or toys to move it to a social reward. And if the mother cooperates, and in this case, the mother was superlative efficient, and she would give him the 2-3 hours of practice that we used to tell her to do. And this child, within 8 months, developed the social interests. So where he would work only for the mother's praise. If the mother said, good boy, that was it for him. So that was beautiful. Any questions? I will be happy to answer.
We will be doing the questions at the end, Radhika.
All right. Okay.
Thank you so much. Thank you, Radhika, for enlightening us on this new concept of ABA. Though we had heard so much, learned about Skinner's analysis during our student days, about the verbal language, it was truly very enlightening, especially about the basic behavior principles and the ABA process. I hope SLPs try to implement this and bring changes in the child. Thank you so much. Our next speaker is Namrata Pai. Namrata Pai is the founder and clinical director of Magpie Speech Therapy, a specialized pediatric only intervention center located in Bangalore, and co-founder of Magpie. Magpie Think Labs product development unit of Magpie Speech Therapy. She's a gold medalist from ISHA, Mysore, with 17 years of hands-on clinical experience. Her clinical training background includes various international certifications, which includes programs from the Hannon Center, Canada, to name a few. She's the first Indian speech language pathologist to be clinically trained from Social Thinking, Boston, USA. Child-centered intervention practices specific to neurodiversity and parent coaching fuels her passion to provide high-quality, individually curated successful communication programs for families in India and abroad. She believes that a dash of positivity and optimism, a pinch of creativity and science, and a splash of soul searching and humor is the perfect recipe for a competent speech language pathologist. Lovely. I had heard so much about you, Namrata. I'm very glad. A hearty welcome to you. Love to hear from you now.
Thank you so
Yes, ma'am.
much. Thank you for giving me this opportunity. I'm really thankful to Isha, and I think today is the perfect day to, talk about my topic. So, are you able to see my screen?
Yes.
Okay, yeah. So my topic is actually scientific approaches to speech language intervention in autism spectrum disorders. And this is pretty much a ocean, a huge topic. And I have tried to condense it from a very speech language pathologist point of view. And so the agenda would be that, I might first talk about the research evidence, which is around therapy and intervention in autism spectrum. Also adding on, how can we as speech language pathologists do our assessments or intervention very much driven by data. And data is definitely something which would drive your clinical decisions, help you figure out whether you are on track, you need to change things. So I hope to cover some of this and get the audience thinking about how is it that they can rethink their clinical practice or fuel some questions around what they are doing right now. Now, whatever I'm going to talk about comes from definitely my own clinical hands-on experience. I still reserve certain hours a week for intervention therapy to see clients, to see families. But at the same time, I have a 25-member strong SLP team. We only see pediatric clients, of which maybe 80% of them are children on the autism spectrum. Whatever data I'm going to talk about today is from all of these sessions that we do, and you can see that we roughly do around 30,000 sessions a year. So our motto is not only working with the child, but also with the family. And especially when it comes to autism spectrum, I think that really makes a lot of difference. The other part is that when apart from our clinical work, we are also coaching parents based on some products which are part of our Magpie Think Labs. And so we have developed some programs around how are we dealing with behavior from a communication perspective, or how do we teach parents to make sure that they are not only interacting with the child, but making sure that they're giving them the right play and the right language. Also, at times when we have kids who have been integrated into mainstream schools, how is it that the school can support? And that is our Cosmos program. So a lot of that data has driven us to come up with some of these programs. When we are looking at children on the autism spectrum, I feel dynamic assessments make a lot of difference. Just relying on standardized assessments is not something which can give us the right kind of information about what we need to do with a child on the autism spectrum. How can we support him? How can we support the family? So we have different dynamic assessment modules depending on the age, depending on whether it's feeding, whether we are looking at social skills. All of these programs are also available through our online mode, which is our Flex program. So you can see that our assessment module for children between 0 to 10 is our Diner Pro, while if it's 11 and above, then it's for tweens and adolescents. Fedora is our oral motor program, and so on. Coming to my presentation for today, so I just felt that when we are looking at science from a SLP point of view, as I said, I'm going to talk a little bit about research evidence, a little bit about patient values and preference and clinical expertise, and how do we build our clinical expertise by doing the right kind of data collection and interpretation. The first challenge would be understanding that we all know that when we see one child with autism, it's one child with autism. So though we might say it's mild or moderate or severe, to just make our life easier, but what we definitely do understand is that doesn't give us a clear picture on the child's language skills or the motor skills or the sensory skills, and each child is so different. So that is one aspect of it. The second is, as part of us as being a speech language pathologist, I know that I'm looking at social interaction, I'm looking at communication, so I have to keep that in mind. And then how can I make it a science and collect data when I have each child who looks so different from the other, though they all fall under the spectrum. The role of a speech language pathologist is huge, and what I have here, it's a small list, and it's an understatement because I know there are so many areas that we can work on. All of the skills that I have developed over time has been, through all the children that I have worked with, and we have realized over time that there's so much more that we can give as a community as being a speech language pathologist. Just to put it in a nutshell, I didn't want to go into specific approaches. So I have broadly divided it into early intensive behavioral interventions, which is like how Radhika ma'am spoke about ABA. At the same time, we have developmental social pragmatic approaches, which are very, very naturalistic in design, which means that it's led by the child. There is a lot of flexibility in how you are working with the family, and floor time, RDI, which is relationship development intervention, and Hanen, which gives a lot of programs for parent training for children with social communication disorders, two specifically being more than words and talkability. The third one, so most of the research in the past 10 years has really focused on something called as NDBI. And these approaches basically combine some principles of ABA with some principle of naturalistic intervention, and ESTM, JASPER, CERTS, all of these are part of that. The reason I put this is those interested can always look them up. But what I have done here is I've just tried to summarize this in these points. So the first part is that most evidence talks about how communication, which needs to be developed, has to start from child initiated teaching episodes, which means that we follow the child or we imitate the child. If the child likes bubbles, I start there. If the child likes jumping, I start there. And I maybe imitate the child. The second part is in terms of communicative temptations. Now, this is given by whether we present, but at the same time, these are very natural ways of tempting a child into communication, and you can again look them up. But just for an example, if I have a bottle of paint, and I keep that paint, I know that the child loves paint. So I might keep that paint in sight, but out of reach in a way that the child will have to come to me to maybe ask for it. Now, when I give him that, I might make sure that I have closed the bottle lid so tight that he can't open it on his own, which means again, I get into the picture where he needs to open it. Now, once I open it maybe for him, he realizes that there's very little paint in it. So we are looking at how we can create these fun sabotages in communication and tempt the child to be connected with us. So now, where are we doing it? So we are not restricting ourselves to a room, to a table, to a chair. We are looking at two aspects. One is, can this be done in a play routine which the child likes, or can it be done in a daily routine? And that can be whether when the child is eating, when the child is, going for a walk, or maybe when the child is having a bath. So thinking of routines where this might work. At the same time, whatever the child learns, it's important that we generalize it. And so if a child is starting to request to open, maybe open bottle, we want him to do open bottle maybe with us, but we also want him to do open cupboard maybe at home, or maybe open puzzle maybe in the school. So looking at three environments and three individuals with which the child can use to tell us that yes, this is something which the child has achieved. At the same time, making it super individualized by understanding that each child has a different sensory preference and a learning style. Some children love to move, some children like to be in their place, and so reading that, and the same child can be moving one day and can be sitting one day. So understanding that part, and also keeping in mind that a lot of children we see on the autism spectrum have apraxia of speech or body dyspraxia. So keeping the motor planning in mind is really important. And last but the most important part would be involving the parent. So it is not intervention until unless you have the parent with you, and there are different levels at which you can involve the parent. But yeah, this is this nutshell or summary of a lot of the research which talks about how evidence has shown that children are really successful if these components are part of your intervention. Coming on to, so the second aspect of EBP is values and preference. So now here I've divided it into patient or client values and preference, or I'm looking at family values and preference. So the reason I included the child separately is because past 5 years have looked at neurodiversity, which means that we understand that compliance-based therapies, and this is basically from a lot of adults on the autism spectrum who themselves have told about how that has led to increased anxiety and poor self-esteem. At the same time, understanding that their sensory processing is such that we can't extinguish or mask it and make it look un-autism-like, which for a very short period. So it is important to understand that we need to respect this rather than have any kind of unethical or abusive standards. And that might mean, again, not looking at putting away all the cars that the child likes, or making sure that every time the child flaps his hands, making sure that I'm going to say no flapping hands. So that is one aspect of it, because the more we understand it, we realize that the child is doing it from an organization point of view. These sensory inputs that he gives to himself makes him ready to learn or ready to focus or complete or initiate or communicate. When it comes to, so when we're looking at the child, we're also looking at the family. And the reason why I have put family here is because when we are looking at parent implemented intervention, one is it needs to be supportive and replicable in day-to-day activities, but at the same time, most of the research talks about 25 hours per week. Now, what is really important for us as SLPs to understand is that a child on the autism spectrum might not be just going to a SLP. He has to go to a OT, he has to go to a dietitian, he has to go to maybe a neurologist, a pediatrician. I mean, there is a plethora of professionals where the child and the family needs to go, which means that if we empower the family and educate the family and give the right steps to follow, it is definitely financially sustainable for the family. At the same time, the family feels successful, because a lot of fear or anxiety from families is because they feel ashamed, they feel they'll be judged, and that's the reason why they don't want to talk about maybe autism or accept the fact that, okay, there are these sensory issues which are associated. So it is our responsibility to make sure that we educate them about it. And I will talk about some things which are specific to that. And at the same time, parent support groups. So being with another parent who's sailing in the same boat really devoids the family of judgment, right? They don't feel that, oh, I am different. So making sure that they're connected and have a support system is really important. The third aspect of clinical expertise for ASD. So how do I as a SLP come to that level of clinical expertise? Now, what's important is to understand that I'm going to do some evidence analysis. I am a person of science. I'm a speech language pathologist, which means that I need to look up what's the evidence around me. I have put up some links here which are absolutely free. Whether it's the evidence maps or the speech bite, where you would get the necessary information. But what you need to keep in mind is that there is information, but you need to figure out whether that fits into what your family needs, what your child needs. So making sure that you are training yourself, making sure you are educating yourself, reading books, doing some trainings, attending conferences, because I am pretty lucky. I am at a center where we have 25 brains brainstorming and figuring out things, but I'm sure that everybody is not so lucky. So making sure that you are doing this part, because finally what you're aiming at is you are looking at building evidence, which is very much practice-based, which can only happen if you are documenting, and that documentation becomes a really big part of that practice-based evidence. What I definitely need to avoid is being a SLP quack. So what I just meant is that, we don't want to do something which is outlandish, maybe doesn't have much research basis, talks about anecdotes and testimonials with absolutely zero research input, or telling you about what was the condition in which the family was taken, or how many families were a part of it, and so on. So, and also we need to be skeptic about when one particular treatment tells you, or one particular approach tells you that it is going to help in the child's auditory processing, in his feeding skills and his motor skills. So it's absolutely unrelated. So what happens is we need to be very skeptic of claims of effectiveness of a treatment for a large range of unrelated problems. So, and we don't want to be desperate and cloud our clinical judgment. And this desperation usually comes at 2 points. When one, we are really trying to push something onto the parent where the parent is not convinced about it. And the second part is when I want to please a parent. So making sure that that is not what guides your clinical decision making. So whether it's one size fits all or tailored to perfection, I think it's a no-brainer. It is tailored to perfection. We are looking at unique neurobiologies. We are looking at unique family perceptions. We are looking at the fact that there are so many approaches and techniques available, and we are looking at documenting it. And that is what will make it, tailored to perfection. Whatever I'm going to talk about henceforth is, related to the fact that most of this data, as I said, is not very specific to a particular child. Take my input also with skepticism and caution. So the first thing which I would like to talk about is the fact that we are looking at assessment. And when we are looking at assessment, we need to keep in mind some of these. The first thing is that collecting data around the sensory system prep for a child on the autism spectrum, which can mean that I'm looking at alerting activities, calming activities. How can I make sure that when I am working with the child, I'm looking at initiation, how is it that I can include materials which are specific to his sensory preference? If he likes water, we are looking at water. If he likes jumping, we are looking at jumping. Not only that, but also making sure that my room, the floor, the place we are sitting, all of that matches the child's sensory system, because that's where his learning will be the fastest, and the number of repetitions you would have to do would be minimal. I have put a resource here for those interested. The second part is we need to collect data around motor planning issues, and this might mean about how do I make sure that the child is seated right. Maybe a certain posture would help him better, and of course, talking to occupational therapists would also give you that data, but making sure that when you are prompting the child, how much prompt do I give? Do I just keep quiet? Do I just give the initial sound? Do I give him hand over hand help for doing something? So that level of prompt is really important, because then you know what to fade away when, and pace the activity. So depending on the child, you might have to do some activity really quick versus you might have to go slow, because you know that this child has processing issues. You are again collecting data around flexibility and emotional regulation, because as a speech language pathologist, I need to be clear about when I have a child showing a particular sensory preference, and which might be difficult for me to handle. I need to know whether it's a tantrum or is it a sensory meltdown. How do I make the child more flexible? How do I make sure that I'm following the child, making sure he's comfortable? Am I going to use a lot of language, or am I going to be quiet? Do I need to give him a hug? So making sure that I am probing for these in my assessment is really important. Also realizing that when my child knows boundaries, he knows when an activity starts, when an activity ends, whether I tell it with actions, whether I draw it for him, whether I write it for him, he will be very comfortable understanding that, okay, I am okay and I trust you. In terms of language goals, so now I come to language. This is where while doing an assessment, you're looking at the child's reasons for communication. You don't want the child to be only looking at requests. I want this, I want that, I don't want this. You want it to be sharing, maybe I see the moon, or it can be maybe I love this, or it can be I want to ask you a question. So looking at those reasons is really important. Second is forms. I want the child to maybe look at me, or maybe point at me, or maybe look and say a word, or maybe point and say a word. So how do I collect this data around reasons, forms, and making sure that I'm getting circles of communication? Now, what that basically means is when I'm opening a circle of communication, when I have a bubble bottle, I'm opening a circle. Him coming to me and taking the bubble bottle is completing that circle. So that's like one circle. I might then give him again the bubble bottle. It's my favorite thing to do. So you might just close it tight and give it, so that again he gives it back to you. So you're looking at the second circle of communication. So you're looking at maybe 15, 20, 25, 30 circles. That is your goal, because that is where the child is ready to move on to the next set of things, which might be more complex and challenging in terms of communication. The second part is in terms of whether I am letting the child initiate, or I am just expecting the child to follow what I'm telling him to do. And definitely, as part of play-based work or child-centered therapy or flow time, we are looking at the child initiating and doing that in natural situations. We are also looking at play skills. How much of play is the child's own idea? And of course, feeding and speech motor comes along with that. And the second part is we are looking at the therapist fidelity, which means as a speech language pathologist, am I using the right style? Am I really letting the child follow me, because, or following the child because I am maybe always telling him to do things, and I'm saying say and don't do this and show. And so if I'm constantly giving him instructions, then that is not follow the child. If I'm looking at body parts and vehicles and animals and alphabets and colors, that's not something which I can use to communicate, versus maybe a hi and an open and a bye-bye. So I might look at really power vocabulary here, making sure that the play is very free will, fun, and I do have a video going ahead which would give you some idea on how making sure that the questions which I use or the comments which I use are pretty much balanced, and how can you actually highlight what you're doing by the way you talk. So before I play the video, I would want you to first think about the first part. So the first part of the video is pretty much where we are looking at the child again. Look at how much is the child looking at the mother, how much is he giving his own idea in the play, how interesting is the play for him. Look at how much is questions. So there are a lot of questions in the first part of the video. Look at how the vocabulary is around colors. But the second part of the video is pretty much where it is free will. The child is enjoying, he's looking more, he is actually giving you ideas in the play, and he's actually imitating the mother. So if you can just play the video for me.
Let's do the puzzle. Do you want to do the puzzle? Yes. Okay. Which puzzle do you want? Crocodile. You want crocodile? Here you go. Let's fix the crocodile puzzle. Wow. What color crocodile? What color is crocodile? Orange color. Orange color? Let's look nicely. What color is crocodile? Double also. What color? You can fix and then tell. Wow. Now look. What color is the crocodile in your hand? Green color. Green color. Okay, coconut bee. Coconut. Okay, coconut. Coconut pizza. Oh, coconut pizza. Okay, here we go. Put coconut. Here you go. Put coconut. Chapati pizza. Chapati pizza. Okay.
Thank you so much. So you could see that So one of the things which was important here was how the position of the mother, maybe when she was in the earlier part of the video versus when she was right in front of him, how the play was so much more creative. There was a gleam in the parent's eye, there was a gleam in the child's eye, and there was so much of interaction going on there. The other part which we are looking at is in terms of the long-term goal data. And here we are looking at how can we collect data around maybe specific to language, auditory processing, executive function. I have mentioned a couple of programs specific to evidence-based around executive function as well. What is extremely important is understanding that as a speech language pathologist, I need to be clairvoyant, which means that I am like this mind reader who wants to understand and put myself in the child's shoe and make sure that I am seeking what is it that the child is trying to do or figuring out, because if I don't do that, I will not be able to figure out what is it that I do next. The second part is in terms of being ethical, which means that whether I am not only keeping my family with me while I'm doing the intervention, but making sure that I'm telling them where am I headed. If I don't know something, being honest enough to say that maybe I don't know this and I might want you to refer to someone who might be able to help you better in this. The last thing being that when we are looking at families, most of the time it is mothers who come, and dads play a really important role in intervention. And so it's important to make sure, like that's what we do at Magpie, where we make sure that the dad join us, whether it's the assessment, making sure they come to the center maybe once a month, but they also are an important part. And when we are looking at children with autism spectrum, it's important to understand that we need both of them to be as part of that intervention process, along with maybe the extended family. Yeah. Looking at what is it that I'm going to give the family. So the question here is, do I just keep the parent with me during that intervention process? Is she just supposed to watch me? Maybe yes. When you're starting, maybe it would start like that. But then you're looking at how can she participate in that? How can she give me some more ideas? Helping the parent to understand what are my child's likes, what are my child's dislikes, how can I use what is at home, making sure that affordances at home are clear to her or to the parent or to the extended family, to make sure that they have what it needs to maybe practice the goals that I'm giving them, and making sure that they understand what is their role and relevance in terms of figuring out what is the goal, where are we headed, what is the progress. That brings me to the fact that we are looking at SMART goals, we are looking at steps and quality in intervention, we are looking at how often do I see my child, and these are some things which you keep modulating. There is no fixed rule to that, and making sure that I have a lot of video data which I can see myself and correct myself. I can look at the family and they maybe correct themselves and change themselves and understand their child better. Just to quickly talk about what are SMART goals. So we all know about specific, measurable, achievable, relevant, timely. So it's so important that I keep this in mind when I write my goal, because I might feel that this is the right goal, but when I write it down and look at it, it's so important that I'm being specific. So here maybe this is an example of joint attention. I know this child is not at a stage where he's going to imitate my words, so I'm just looking at pre-verbal action like looking and smiling or giving me the object. I am looking at a sensory preference. I've put maybe peekaboo or blanket swing. I'm looking at, so I'm being very specific about what is my expectation. I'm measuring it maybe by creating so many opportunities within the session. It is relevant for the child because I'm not going to go to imitation. I know the child is not ready for it. It is definitely achievable because I know that in 8 sessions, I know I would reach here. And I am looking only at the clinical setting. So I know that that's something which I can aim for with this child based on the assessment that I've done. This is a part of our pre and post, which we usually do in terms of that data collection. So this is like we've done it maybe 3 months down the line. We are very strict about that data because that's when we know whether we are on track, where are we headed. This is some of our data around what we collect for our feeding. So we have a separate collection of data for feeding, and again looking at where the child lies, which is his most affected function area, and working on that. We also do some subjective data tracking. So for example, when we are looking at parent groups, where we are training parents, we might have video of a parent and the others might rate. And this is pretty interesting, competitive, fun for the other parents as well. They might rate the video in terms of, okay, like for example, here it's about, is the parent animated? Is he face-to-face? You know, has that environment been modified? And so on and so forth. So we have indoor video rating, we have outdoor video rating, and so on. We love our videos. And the next part is in terms of our Jamboree program, where we are again looking at social skills. So we are looking at maybe me play or me plus you play. What is the child doing right now? Where is he right now? And again, this is a subjective data tracking, which you might do every session. Yeah, so it's all about collecting data. As speech language pathologists, we can definitely do that. We need to collect the right kind of data. Only when we collect that data, we know that we are getting the information and the insight to what we need to change or what we need to do next. So my final thoughts here are basically be positive, be a learner always. Always think that you need to rethink, be better than what you are. Keep family-based intervention as priority, and understand that you are making a difference. You are grateful to be in a profession like speech language pathology, where you can definitely make a difference, and you should go all out to do that. For those of you interested, there are these couple of books which I have mentioned here. At the same time, there are these 2 open source articles which are excellent. They are all 2021 published, and they talk about a lot of evidence, as well as the last article is about collecting data from a lot of teenagers, adults with autism, who speak about insights, which is very, very powerful. Yeah, and this is the message I give all of you. Thank you. That should be it.
Thank you so much. Thank you, Namrata, for giving an elaborate view on autism, and especially highlighting on the NDBI aspect also, and especially the data tracking, which is very, very important. Thank you so much. We would like to hear from parents also. So let me welcome Snehal Patil. Snehal Patil is a mother of Rudra Patil. She's working in an IT sector since 12 years. Her son is 5 years old and was diagnosed with mild to moderate autism at the age of 2 years, 5 months. She's been attending speech therapy sessions at Magpie since 2 years, 5 months. Let's hear from Snehal now. Welcome, Snehal. Is she on the board?
Yes, ma'am, she's there.
Hi. Hello.
We can hear you,
Hello.
Snehal.
Yeah. Hello all. Thank you for this opportunity. I'm Snehal. And as she mentioned, my son was diagnosed with autism when he was 2.5 years old. And the biggest challenge for a mother or any parent would be to accept it, because the awareness of autism is very less among parents, especially the new parents. And fortunately, I was lucky enough to get good guidance to convince me enough that it's not the end, it's the start of a beautiful journey with your kid, but it's just that it's a unique journey. And when we realized when he was 2 years old that he has poor eye contact and he was not able to speak like others, we started off with his speech therapy. And then I realized, when I started with his speech therapy, that it is not the words which matters. What matters is how your kid looks towards you. What matters is how much he wants to play with you. So even the small gestures are very important in your life. So when the speech therapy was ongoing, I learned a lot of techniques from the therapist. And parallelly, I started with his occupational therapy as well. And together was making good wonders, these two therapy together. And after a few months, I was lucky enough to get even the parents training, which helps you to play with your kid, to know that only words doesn't matter. There are a lot of ways your kid can communicate with you other than words. And also it shows that, the bonding between you and your son increases when you know how to understand your kid better. I also started with a sensory integration program, and during this pandemic, we faced a lot of issues, but fortunately, this parental trainings helped me, and I was able to coordinate with my therapist, and the techniques, whatever he taught me during the therapy as well as the training, helped me during my offline and generalization. So I would suggest everyone that what worked best for my son was the early intervention. Secondly, starting the therapies at the right time from the experts, and also the parental training. This parental training, as ma'am said, I have been practicing it in my routines, and yes, now I'm a very proud mother of my proud son. Thank you.
Thank you, Snehal. It was so nice. You shared your views. Over a period of time, you will be the best therapist. The mother is the best therapist.
Yeah,
And
thank
all the
you.
best to you, Snehal. Yeah, all the best. Our next parent, they are Gaurav and Sonal Arya, the parents, and their son is Advik, who is 8-year-old, going through ABA therapy at Sambad for about 3 years. Welcome, Gaurav and Sonal Arya. Hi. You have to unmute yourself. Just see, not able to hear you. Yeah.
So my kid name is Advik. He's now 8 years old. So he was diagnosed with speech and behavioral issues somewhere at the age of 2.5. So we started with speech therapy, and we did it for somewhere like 2 years maybe, but we didn't see a lot of growth considering only the speech therapy. And then we went to the Samvad Center in Bangalore, that is being governed by Radhika ma'am, and they told us the importance of ABA that will actually work for Advik. They told us that the speech and the ABA has to go hand in hand to bring the correct change in Advik. So yeah, so we did the speech and the ABA therapy, and it actually worked with him. When he went there, he was somewhere 4 and used to say like 1 or 2 words. It's more of a need-based speech. But now they told us, okay, like you have to appreciate the good behavior and you have to just ignore the bad behavior, irrespective of how motherly you feel and all that stuff, but just avoid the bad behavior. And for good deeds and everything, you have to give the reward. And that particular approach actually works not only in the behavior, but also in the speech. For after 3 years of me going there, now he's somewhere 8, and he's able to speak full sentences. Initially he will not take the instructions, he will be very stubborn, he will not listen to you, he will listen only what he is interested in, and if he is not interested, he will not just listen to you, he will avoid any kind of communication. So he will throw tantrums. At that time he has made his behavior as a part of his communication, a way of his communication. But then after going the ABA guidelines and what ma'am has told us, we started working on that, and now the behavior has also got better with the reward system and acknowledging the good behavior and avoiding the bad behavior. So now he's able to say full sentences, he's able to tell stories, he's able to give answers to most of the questions, and he's doing better. And for now, like in the COVID time also, we have a full guidance of ma'am just like in this month we are working on his tenses and all, so he will be able to tell me what he has done in the full day and what he wants to do the next day. So she is telling me how to correct his grammar. So it's all stepwise approach that we have been guided with Radhika ma'am and the ABA therapy. And now I think that in course of time his speech will be in correct path. So that's what. Even we had a speech therapist. Her name is Uttara from somewhere. She also helped us a lot. She is one of the therapists who could get a good control on Advait, because she was actually giving emphasis not only to speech but also on his behavior. So those two things went hand on hand, and now we are on a better place. So that's what I think.
Thank you so much.
Yeah.
Thank you for sharing your perspective. And see, behavior is so important with communication. And by when you do the ABA and communication as such, especially the reinforcement aspect in behavior, when the reinforcement is immediate, the behavior changes and it helps in communication. All the best to both of you and to Advait.
Yeah. Actually, I just wanted to add one thing. I just missed out.
Yeah.
This reward system is
No.
actually the key.
Yes.
Whether it's in behavior and in the.
the
For nowadays, we are doing the work with him. For every correct question, we will use the token system or the star system. If you're giving me the correct answer, I will give you a star or a token. And that helps to bring his patience, his sitting tolerance, and his interest at the same time. So he performs really well in that scenarios. So it's very important to have a reward-based approach. Yeah.
Thank you so much. And all the best. Yeah, all the best to you. Okay. Now next we'll go over to questions. Questions to the speakers. Garima will
Yeah.
take over. Questions,
Yes.
Garima?
Hi. Yes, ma'am. I request Radhika ma'am and Namrata ma'am to switch on their cameras and mic. Yeah, thank you, ma'am. Yeah, there's a question from Miss Neha about ABA. Suppose the child with autism has flapping hand behavior or meaningless utterances. How do we apply ABA to it? Please explain with an example. Radhika ma'am, the question is to you. Should I repeat?
I think you should.
Yeah, Radhika ma'am, can you hear us? She
Maybe
lost
she
her audio, I think. No, oh, just a second.
Radhika, can
Yeah,
you
ma'am.
please
Now,
unmute?
yes.
She needs to
Yeah,
unmute
now
her
she's
mic.
unmute. Now she's unmute. Yeah, Radhika ma'am.
Hi, I was trying and it was saying organizers.
Yeah. Oh, yeah. So
So,
I'll repeat the question. Suppose
yeah,
a
I
child with
understood.
autism. Yeah. Okay.
Yeah,
Okay.
but see, this is we cannot give answers like that suddenly just without knowing the exact problem and analyze the child. But the main focus is to focus not on reducing flapping, but focus on teaching him meaningful skills. Right? Our focus is not on stopping the flap. When you teach him meaningful skills, he will learn and he will reduce that. Right? And we focus on teaching him meaningful words. Then automatically meaningless words will be. Right? So our focus is always on teaching positive things. See, a child with autism has absolutely no, what do you say, when he comes to us, if he's working meaningfully, he will also not be able to follow instructions. So what does that mean? He doesn't have enough language in his brain, right? So what is he going to talk about? So naturally he's bored, he will flap his hands. Naturally, if you are bored, we will communicate. We will take our phone and we'll communicate with our family or friends, right? But a kid with autism who does not have any language, who does not understand what's going on, he loves to be by himself. He'll do so many things. So our focus always has to be on getting him to do meaningful stuff, learn, understand language, learn to communicate in an appropriate manner. All the other behaviors will disappear.
Okay, ma'am. Thank
Radhika,
you so
ma'am,
much.
can I add one more thing?
Yeah.
Yeah. So usually what happens is if the child is flapping, I think whoever has asked this question has to think about what is she doing to make him flap.
What
Okay,
is
and
she?
what I'm trying to what is she doing to make him flap his hands, because maybe he's anxious or he's super happy. So the question here would be, she needs to maybe interpret herself and figure out what is it that she can do to give meaning to that, and maybe read that behavior. It is communication. Behavior is communication. So that flapping is either telling you that he's really happy with it or he's really
Absolutely.
anxious. Yeah.
So we have to teach appropriate behavior, how to be appropriate, because most of our children will flap when they are anxious or they are happy or they're bored. These are the three scenarios that they will flap, right? And because they have nothing, they have no other form of communication. So unless we give them a form of communication, right, then only they will learn an appropriate form and they'll keep themselves occupied in a meaningful manner. Children with autism has such limited attention span to play also, right? They cannot even sustain play. So how will they do? Naturally, they're going to get bored. So I have seen quite a few of them. Once they know how to communicate normally, and their speech, all these behaviors can reduce. When we teach them an appropriate way to express themselves when they're happy, and even if they do a flapping, we are not going to stop them too much. We are not going to be forcing them fold their hands all the time, right? We allow that expression. We help the parents accept that that is his form of expression, right? If he's happy, if he's jumpy and he's learning, we will keep trying to teach him a better way. Till then, we allow that flapping, right?
Okay. Thank you, ma'am, for that. Next question is to Namrata, ma'am. You have talked about social data tracker, right? Social skills data tracker. So, like, how is it your devised, or you have like some references for that? Someone was asking
Uh,
about it.
all our trackers are our own intellectual property. We have, as I said, generated them over hours of clinical experience. But I can definitely suggest some resources for you. So it depends on what social skill you're looking for. But if you're looking for a child who is maybe with good cognitive skills and on the spectrum with language skills as well, then you're looking at social thinking. And social thinking is definitely a resource. They have a lot of books around, social skills tracking. And if you're looking at maybe a child who is still pre-verbal and still you're looking at social skills, then you would want to look up the peer skills chapter in the More Than Words book.
Okay. Okay. Yeah. Okay. That's it. We don't have any more questions, but it was actually a very wonderful program, and we really thank both of you from bottom of our hearts for accepting this and doing this on this special day. And special thanks to Mr. Gaurav and his family, Miss Nehal. Both the parents were very supportive throughout the dry run. I should appreciate their efforts, and it is sometimes not very easy, to come on the platform and talk. It requires a lot of courage. We see a lot of parents in day to day life and they don't want to talk about it, and I really appreciate both the parents who took out time and figure out in their busy schedule they could make it. Thank you all of you for being with us and training a lot of people here. On this note, I from Isha, I thank you and will close the session today. Can we have both the parents video on for a second if possible? We'll just take a screenshot. Snehal was having little tough time, I think, Mr. Gaurav. Yeah. Okay, no problem. Yeah, thank you.
Yes.
Thank you so much. I'll just take a screenshot. Yeah, thank you. All the best to both the parents for your children, and you have wonderful support system with you. Thank you so much. We'll close for today.
Thank you very
Thank you.
much.
Thank you so much.
Thank
Thank
you.
you.
Well organized.